welcome to our channel of EDU-CARE, and today we will be learning something different concepts. So today we will be focusing on the bone. Which bone? The humerus bone, which is present in the arm region of each and every body. Arm region, as you can see here, I will open the pointer. See, this is the arm region, this is the humerus bone, this is the humerus bone, this is the ant region. How you can determine this is ant? Because here I can see the clavicle and I can see the sternum over here. And this is the lateral view, the side view of the, you can clearly identify which is the lateral, which is the outer, and which is the medial view. This is the scapula, this is the clavicle, this is the humerus bone. How it is clavicle? This is the clavicle. Here you can see we are viewing. This is a view from from the inferior part. From here you can see this is a view. So acromion, this is the anatomical neck, epiphyseal line, humerus bone, lateral epicond. This is the distal part, which will be covering in the next video. But today we will be learning only regarding the proximal part and the middle 1/3. This is the scapula. Head of the humerus articulates with the glenoid cavity. Here this is a glenoid cavity, so that joint is called as a shoulder joint. Shoulder joint is between the head of the humerus and the glenoid cavity. Let's move to next slide. Humerus, it is a long bone in the arm. It is a long vertical bone. It is a long vertical bone in the arm. It is divided into three parts: proximal 1/3, middle 1/3, and distal 1/3. Proximal, it articulates with the glenoid cavity, and distal with the elbow joint. As I said, it articulates the glenoid cavity to form the shoulder joint. The head articulates with the glenoid cavity. Distal with the elbow joint. This is not required for now, but always remember this thing. This is the humerus bone, this is the proximal, this is the middle 1/3, this is the distal. Distal we will be covering in the next video. Today we will be learning only this region, proximal and the distal. Now this is the anterior view and this is the posterior view. Anterior, this is lateral, means away from the body, medial towards the body. Here you can see the greater tubercle, you can see lesser tubercle. This is the lesser tubercle, greater tubercle. Between this tubercle there is a one more groove which is called intertubercle sulcus. The name also denotes intertubercle. Inter means between the both tubercle sulcus. This is the head region. And there is an anatomical neck and a surgical neck. Here you can see the deltoid tuberosity. Deltoid, why? Because the deltoid muscle is inserted. Therefore the word comes deltoid tuberosity. Tuberosity means the in the extension of the bone. In the here there is an extension. As you can see, the extension in the bone. This is called tuberosity. This is the medial. This is the anterior view. This is the posterior view. Medial and lateral. I'll remove the pointer. You can see the screenshot. No worries. Yeah. This is the view, actual view. Here you can see the distal, actually little confusing. So just focus on the proximal and the middle part. Yeah, understood this point. Yeah, let's move to next slide. Head region. Head region, you can see two neck. Anatomical neck which lies like this, and surgical neck which lies horizontal. So this is the two neck which you can present here: anatomical and surgical neck. Great tuberosity, lesser tuberosity, and the bicipital groove, which means the intertubercle sulcus. This I am repeating because these three parts are very important when we are studying over the proximal region. Here you can see the clavicle, scapula, and the acromion. The joint between the acromion and the clavicle is called acromio-clavicular joint. This is the coracoid process, and this is the scapula. So now let's move to next slide. So we learned about the head region. Head region have three important. What is that? Great tubercle, intertubercle sulcus, lesser tubercle. Because this till the another time which we are consuming, which is based on that only, the muscle attachment, the origin, and the insertion of that muscle. So let's focus on that thing first. This is the where is the my pointer? Yeah. Here this is the great tubercle, this is lesser tubercle, and this is the intertubercle sulcus. Now neck is not that important, but it's okay if you understand it. It's very easy. There is a scientific reason why it is called anatomy, why it called surgical neck. Now this diagram very important if you want to, because in the exam most of the examiner always look for the diagram, so you can refer this diagram. I'll remove all the ink which I have written. So this is the diagram you can refer. It's very clear and you can identify the part. This is the coracoid process, this is the acromion process, clavicle, this is the humerus. Yeah, great tubercle. Great tubercle has three muscles: supraspinatus, infraspinatus, teres minor muscle. Supraspinatus is above the spinous process, infra means below the spinous process, teres minor muscle. Great tubercle is this region. Great tubercle muscle attachment. Here there is three muscles that are attaching in the superior part, then the middle, in the posterior part, then to the inferior. It will be like this: superior part, middle, and the inferior part. Superior will be the supraspinatus, the word supra. Infra means this is the posterior part. Teres minor from inferior part. As you can see this diagram. Supergreat tubercle, crest means the depression need external layer. Even the lesser tubercle has crest situation, and the space between both is the intertubercle sulcus. That is the delta tuberosity. Crest of the lesser tubercle. This is the crest, lesser tubercle, head of the humerus. Understood? Great tubercle has three muscles: which are muscles, supraspinatus muscle, infraspinatus muscle, and the teres minor muscles. Now lesser tubercle. Lesser tubercle has only one muscle. Always remember, greater tubercle has three muscles, lesser tubercle has one muscle. Which is that muscle? Subscapularis muscles. See, you can see subscapularis muscles which are found. Now these tubercles are found in the proximal, but as we know that both regions are present in the proximal region. There is a crest, the depression which extends till here. This is also crest, the extend till here, and the region, this is the intertubercle sulcus. Intertubercle sulcus also called bicipital groove. So let's move to the next slide. The bicipital groove. Bicipital groove is a region between the both tubercle. Why it is called bicipital groove? We will learn in this topic. Yeah, bicipital groove. Bicipital groove is the region between both the tuberosity, the greater tuberosity and the lesser tuberosity. Now let's learn the reason behind that. Why it is called bicipital groove. The long head of biceps. I'll open the pointer. The long head of biceps tendon. Tendon means the muscle is attaching to the bone. Which bone? The humerus bone. Therefore, it is called tendon. Which originates from? Origin means the origin from the superior rim of the glenoid of the scapula. It passes through the shoulder joint and it enters the bicipital groove. Now, I'll explain this part. The biceps muscles, it originates from the glenoid of scapula. Glenoid is the glenoid cavity. Suppose this is the glenoid cavity and this is the humerus, head of the humerus. So this will articulate. It will be the ligament present between that, right? Which to attach. So this will be the shoulder joint. Now this is the region over here. The superior is called superior rim, and the region below is called the inferior rim. So here the origin of the biceps muscle will start, and it will come down. Where it will come down? It will pass through the shoulder joint. Which is the shoulder joint? This is the shoulder joint. It passes through the shoulder joint, and where it enters? It enters the bicipital groove. Therefore, from this region the biceps muscle is passing. Therefore, the names come bicipital groove. Now we learned about the origin of the biceps muscle. So there will be a big question: where does it insert? It insert to the distal part of the radius. Distally to the radius. Radius is the bone in the forearm region. It flexes the elbow joint and supinates the forearm. What flexes the elbow joint? The biceps muscle. What is the function of this muscle? So always, whenever studying the muscles, you always have to keep in mind that you have to learn the function. So it flexes the elbow joint. Flexes indirectly means the decreasing the angle. Suppose this is the arm region, this is the forearm region. So suppose you are moving your forearm towards the arm. Suppose in the exercise in the gym, you know all this. So this is the decreasing the angle between the arm and the forearm. The action is called the flexion. It helps for the flexion of the elbow joint. And supinate. Supinate means keeping the so that the palm is facing upwards. The palm face upwards. Whereas there is the opposite of supination is the pronation, so that the palm face downwards. Clearly, so we learned regarding the bicipital groove. We learned about the muscles. Why the name bicipital is given, because of the biceps muscle is passing through the bicipital groove, and it passes the first enter shoulder joint and passes through this muscle. Then we learn about the function of the biceps muscle. What is the function? It is the help in flexion of the elbow joint. It also helps in supination of the forearm. Then we learned about the origin and the insertion. Origin is from the superior rim of the glenoid cavity, and insertion is toward the distal end of the radius. Yeah, this is the picture which we learned today, great tuberosity. Then we learned about the bicipital groove. See that there are two bicipital, there is a whole the groove, therefore bicipital groove. Then you can see the superior rim from the, whenever you see something from the top view, the view is called superior view. Then superior border of shoulder joint. Shoulder joint is between the glenoid cavity and the head of the humerus. You can see clearly over here. This is the glenoid cavity and this is the head of the humerus. This is the scapula. This is the acrum and coracoid process. This is the acrum and process. Next slide. Now we will be learning regarding the lateral aspect. What is the there are two aspects, right? Lateral means away from the medial central line, and whereas the medial is toward the central line. So lateral, what is such special in the lateral aspect? Let's see. Lateral side we can see the deltoid muscle is attaching. Deltoid muscle is the muscles of a shoulder, right? Suppose this is a shoulder, this is a arm region. This is arm. The region here, the muscle which attaches the deltoid muscles. This muscle is the deltoid muscle. Where is attached? It is attached to the deltoid tuberosity. This is the deltoid tuberosity here, Actually it comes like this. See this picture, you can see clearly. This is the deltoid tuberosity and this is the deltoid muscle. It is a triangular in shape. Deltoid muscle is triangular in shape. So lateral aspect, which muscle you can see? You can see the deltoid muscle. You can see it inserted in the deltoid tuberosity. In this diagram, you can see this is the head region, great tubercle, and this all the you can see. This is just as an intro for you because I'll be taking the muscle also for this. No worry, just stay connected with me. See, we learned till here, till the deltoid tuberosity. Head region we studied. Anatomical neck also I told, surgical neck also I told, great tubercle I told, lesser tubercle I told. Then also I discussed regarding the bicipital groove, why the name bicipital groove is given. Understood? Till here you understood? It's okay, fine. Let's learn about the medial aspect. Lateral we learn about the deltoid muscle. Now medial also we have to learn what is the special aspect in the medial region. Medial region, as you can see, medial is this region. Now here you can see such a big muscle which is occupying the major portion of the posterior region. How I can say this is a posterior? Because I can see scapula over there. See here you can see the scapula. This is spinous process, upper part, lower part, supra and the supraspinatus, infraspinatus. So it's very easy to determine the posterior and the anterior region. Now the anterior medial surface, till here you skip, till from here till here skip, because here we are trying to understand the concept, not to make a concept more complex. So first try to understand it and then you learn. Always remember this thing. First always try to understand, then you try to learn it. First if you will try to learn and understand, you will understand nothing. So first always try to understand, then you learn. Its upper part is narrow. As you can see, the upper part here is narrow and the lower part is very broad. See, you can see it is very broad. The upper part is narrow, the lower part is broad, which attached to the floor of the intertubercle groove. Intertubercle is also called as bicipital groove. Why it is called intertubercle? Because it is present between the two tubercle, greater tubercle and the lesser tubercle. The name also says intertubercle groove. So which muscle is this? This is the latissimus dorsi muscle. The latissimus dorsi muscle is attached to the floor of the intertubercle groove. Intertubercle bicipital groove is further divided into three regions: lateral lip, the floor, and the medial lip. Lateral lip, floor, medial lip. Lateral, floor, medial lip. So which muscle is attached to the floor? That is the latissimus dorsi muscle. Why we are studying in the medial aspect? Because it arises from the medial side of the body. As you can see, it moves from the medial side of the body. Therefore we are learning in this medial aspect. Understood? It's a very easy topic to understand. Don't make it complex. As I said, the upper part is narrow, lower part is broad. It occupies the majority portion of the posterior region. Then it inserted to the floor of the bicipital groove, which gives insertion to the tendon. Tendon means the muscle attachment to the bone. Which bone? Humerus bone, to the latissimus dorsi muscle. I hope you are clear with this. As you can see the inferior angle origin, then you can see this is not such required because we are just reading about the medial aspect and we are learning about the insertion of the latissimus dorsi muscles. Yeah, so which muscles attached to the greater tuberosity? We learned about the greater tuberosity which arises at the lateral part. I'll open the pointer. Lateral part and the medial part. Lateral part we learned regarding the greater tuberosity. Medial part we learned about the lesser tuberosity. So we will learn which and all muscles are attaching to the greater tuberosity. There are total 3 muscles are attached to the greater tuberosity, which we learned in the previous slide. That is supraspinatus, infraspinatus and the teres minor muscles. So let's see that muscle one by one. Supraspinatus muscle, as the word says supra. Supra means superior to the spinous process. Which spinous process? Of the scapula. This is the scapula. So this is the spinous process. The above is the supra and the below region is the inferior region. The superior region is called supraspinatus and the inferior is called the infraspinatus. So supraspinatus is attached with the upper part of the great tuberosity of the humerus. It lies, as I always said, this is the upper part. Which muscle? The upper part. This is the infraspinatus and this is the teres minor muscle. So supraspinatus muscle attached to the upper part of the great tuberosity of the humerus, and it arises from where does it arise? It arises from the fossa. Which is the fossa? As you can see, we will remove the markings. Suppose this is the scapula. So there will be a dissection. Just this is a dissection. This dissection is a spinous process. All this is a spinous process. So whatever comes above the spinous process is supraspinous. So you have till from there is some depression or a kind of depression, not I cannot say depression, but a kind of depression. So that region is called as a fossa. So from there a muscle arises. Supraspinatus muscle arises from supraspinatus fossa. The word suggests supraspinatus muscle, supraspinatus fossa. And we have to learn regarding the function. If you are studying regarding the muscle, then we have to always learn regarding the function. What is the function of these muscles? How you can learn the functions? Because this muscle lies in the posterior part, because I can see the spinous process of the scapula. So what is the function of this muscle? The function of this muscle is abduction. What is abduction? Abduction is moving something away from the body, not towards, away from the body. Suppose this is towards, this is away from me, abduction. If I am bringing it, suppose if I am bringing something towards my body, then it is adduction. Suppose this is my arm region and the forearm, this is my total hand region, my upper limb. If I am moving my upper limb away from the in the superior position, then it means I am moving the upper limb away from the body. I am moving the upper limb away from the center line. But if I am bringing towards the central line, it means adduction. If I am taking away, it means abduction. I hope you are clear. Now once again, let's see regarding supraspinatus. Supraspinatus attached to the upper part of the great tuberosity. Upper part means regarding here upper part of the great tuber, because here I can see the great tuberosity of the humerus. So it attached to the upper part of the great tuberosity. And from where does it come? We learned regarding the insertion, where it is inserted to the upper part. From where does it come? It comes from the supraspinatus fossa of the scapula, from this region. It comes from this region and attached here. Therefore I am drawing a diagram like this. It comes from superior part of this region. It attaches to superior part of the great tuberosity. From it comes from supraspinatus fossa. And what is the major function? Its function is abduction of the arm. Abduction means away from the body. Now second muscle, which is the infraspinatus muscle. This is also similar like supraspinatus, not an easier thing to worry. Just like the infraspinatus, supraspinatus have a fossa, here also infraspinatus have a fossa, a kind of depression, not a deep depression, but just like a depression. See here, yeah. So here you can see the fossa. Here this is the fossa from where the muscle arises. Now where does it inserted? It is inserted to the posterior part of the great tuber. Whole of the posterior part means everything, the whole muscle is arising from the posterior part, whereas in supraspinatus it was posterior but it was lying upper region. This is the posterior, mean the whole region is attached to the posterior part. As you can see here, it is regarded. I'll remove the pointer. See, this is the posterior part of the humerus. So the whole muscles are attached to the posterior part of the great tuberosity of the humerus. And from where does it come? It comes from the infraspinatus fossa of the scapula. And what is the function? The muscle which is present behind have a similar function. What is that function? First is the abduction, second is external rotation of the arm. External rotation means of the arm means moving the arm externally outward. Whereas if I am talking about the anterior region, then internally rotation of the arm. So this is very important. First you have to learn regarding the origin. Second you have to learn regarding the insertion. Origin, it comes from the fossa. Which fossa? Infraspinatus fossa of the scapula. Where does it inserted? It is inserted to the posterior part of the great tuberosity of the humerus. Yeah, second muscle is clear. It is similar as supraspinatus, not a thing to worry. Let's go to teres minor muscle. See this picture shows the clear representation. See, as you can see, the upper part of the great tuberosity is attachment to the supraspinatus. Then behind I hope you cannot see because it is in the posture. This region is the anterior, because here I can see the clavicle, I can see the ribs over here. Then you can see the teres minor clearly. This also muscle arises from the back side of the muscle which attached to the inferior part. The posterior part is the infraspinatus. The superior or the upper part of the great tuberosity is supraspinatus. Teres minor muscles. Teres minor attached to the posterior as it lies in the posterior region. Inferior, why? Because it lies like that inferiorly to the great tuberosity of the humerus. From where does it come? It comes from the lateral border of the scapula. As you can see the scapula over here, this is the medial end, this is the lateral end. It comes from the lateral upper part. Why upper part? Because here you can see the teres major muscle. Therefore you have to clearly mention the lateral upper part of border of the scapula. You cannot write just lateral border of scapula, because laterally there are many muscles present of the scapula. Teres major is present, teres minor is present. Which muscle you are talking? You are talking only about teres minor muscle, so you have to mention the upper part of the region. Then what is the function? Similar function we learned about the infraspinatus, what? External rotation of the arm, external rotation of the arm. This all term we will be learning in the general anatomy. Don't worry, I'll be posting one more video regarding this. Yeah, just focus on this muscle. Three muscles we learned: supraspinatus, infraspinatus, and the teres minor muscle. Supraspinatus covering the upper part of the great tuberosity, infraspinatus covering the posterior, the whole posterior part of the great tuberosity, whereas the teres minor covering the inferior part of the great tuberosity. Means total it is covered by the muscles. Which muscle? Three muscles. Right? Understood? Once again we'll revise again. Teres minor origin. Where does it origin? From the upper lateral border of scapula. Where does it insert? Insert to the posterior inferior part of the great tuberosity of the humerus. What is the function of this muscle? The function is similar as the infraspinatus, externally rotation of the arm. Let's move to the muscles of the lesser tuberosity or the tubercle. Tubercle is same as the tuberosity. I repeat, tuberosity is similar as tubercle. So there is only one muscle attachment, that is subscapularis muscles. Subscapularis sits within the scapula. The scapula, which we learned from behind, have a spinous process. The anterior of the scapula does not have a spinous process, as you can see here clearly in this diagram. This is a scapula in the anterior part. So this anterior region arises to the lesser tubercle. So you can clearly differentiate the greater tubercle and the lesser tubercle. Great tubercle, all the muscle is attached in the posterior part, whereas the lesser tubercle, all the muscles are attached to the anterior part. Now let's learn about origin and the insertion. Origin. Origin arises from the anterior of the scapula, the whole anterior of the scapula. The muscles arise from the whole anterior of the scapula. What is the insertion of the muscle? The insertion is the lesser tubercle of the humerus. Very easy concept to understand if you try to understand it. Origin is from the subscapular region, means the anterior region of the scapula, whereas the insertion is the lesser tubercle of the humerus. What is the function? Since this muscle lies in the anterior region, so the function will be opposite as the posterior. Posterior we learned regarding abduction and the external rotation of the arm. So here we will be learning regarding the adduction and the internal rotation of the arm. Here's the difference. Here it is a de-adduction, whereas in the posterior there is abduction, A and B. Here it is A and D, and internal rotation of the arm. I hope you are clear with this. If you have a group into all this picture, you can see this is a suprascapular foramen, no need. Subscapularis we learn anterior region. Then you can see the teres minor muscle, see here, which lies in the posterior region. Then this is the latissimus dorsi. Latissimus dorsi we learned, right? Latissimus dorsi muscles. This is the muscle of the bicipital group, which we learning in the next slide. Yeah, we learned regarding the muscles of the tubercle, great tubercle muscles and the lesser tubercle muscles. So there is an important term we left out, that with the bicipital groove. So there is a muscle attached in the bicipital groove also. Which are those muscles? There are three muscles attached. Which is that muscle? The first one, the pectoralis major muscles. Second is the latissimus dorsi muscles. Third is the teres major muscles. That latissimus dorsi muscle we already learned. Where do we learn? We learned in the medial aspect of the humerus. Remember I said there's a major portion is covering the posterior region. Which is that muscle? That is the latissimus dorsi muscle. So we already learned. Where is the insertion of that muscle? Is the floor of the bicipital groove. Now there is a three region. Bicipital groove can be divided into three regions. First is the lateral lip. Second is the floor of the bicipital groove. Last is the medial lip. Lateral lip lies in the lateral region. Floor lies in the center of the region, which lies in the extend to downward, whereas the medial lip lies into the medial region of the bicipital groove. For proving this, I will show you one diagram which you can understand clearly. You can see medial lip. This is tail it extend. Here is the center is the floor, and this is the medial lip. This is the lateral lip. This is the medial lip. Why it is? Because lateral is attached to lateral lip is called, and medial lip, it is present in the medial side, and center is the floor because lies between the lateral and the medial lip. And I already explained why it is called bicipital groove, because the bicep muscle passed through that groove, therefore it is termed as bicipital groove. Let's go to that page once again. Yeah, muscle. Which muscles are attached? First is the pectoralis major muscles, then the latissimus dorsi muscles, third is the teres major muscles. We learned regarding the teres minor muscle. Teres minor muscles comes under the greater tubercle muscles. Remember? Yeah. Pectoralis major. Pectoralis major attached to the lateral lip of the bicipital groove. Where? To the lateral lip of the bicipital groove. Second is latissimus dorsi. Latissimus dorsi muscle attached to the floor of the bicipital groove, whereas the teres major muscle attached to the medial lip of the bicipital groove. It is a very simple concept. If you try to understand, you will be able to connect the term which I am telling. I'll repeat once again. PLT. P refers to pectoralis major. Pectoralis major attached to the lateral side, which pectoralis major is the muscle of chest muscle. Is inserted from the chest, I remember, from the ribs. Not required for a while, just to understand. Inserted in the humerus region. Humerus, where it is attached to the bicipital groove. Which region of bicipital? To the lateral lip of the bicipital groove. Second, the latissimus dorsi. Latissimus dorsi attached to the floor. Already we studied regarding this muscle. It is the muscle which lies in the posterior region. Pectoralis muscle is from the anterior side, whereas the latissimus dorsi is the muscles of a posterior region. Then we come regarding the teres major. Teres major also lies in the lower lateral border of the scapula. Why lower border? Because the upper border of scapula is filled with the origination of the teres minor muscles. I already said. Therefore, the term upper lateral border is very important, because lower lateral border is the origin of the teres major muscles. So it's a very easy topic. You can learn this as a topic as P. First, second is L, then T. P refers to the pectoralis major, L refers to the latissimus dorsi, and T refers to the teres major muscles. As you can see in this diagram here, the pectoralis major has been sectioned to give a clear view. From the lateral lip, then center is the latissimus dorsi muscles, then behind you can see the teres major muscles. I hope you are clear with this term, right? So today what and all we learned? We learned regarding this diagram also I showed you, right? The teres minor muscle attached from the posterior region. Then this is the supraspinal from the top of the greater tuberosity. Then this is the muscle from the anterior region, right? Yeah. So I am done with my topic today. What and all we learned, we just learned regarding the proximal region and the medial one third. Why medial one third? Because there was a deltoid tuberosity, right? Deltoid tuberosity, where the deltoid muscles were inserted, and it was originated from the lateral aspect. Remember, lateral aspect, I said there is a deltoid muscles. It insert in the deltoid tuberosity, which comes in the middle one third. Then we learned regarding the bicipital groove. We learned regarding the muscle, which and all the muscle attached to the bicipital groove. Just now we completed pectoralis major muscle, the lateral lip, center to the floor, which is that muscle, latissimus dorsi, and the medial lip, which is that muscle, teres major muscle. Then we learned regarding the greater tubercle, lesser tubercle muscles, supraspinatus, infraspinatus, and the teres minor is from the greater tubercle. Lesser tubercle has only one muscle, which is that muscle, subscapularis. How I can know subscap? Because it lies in the anterior region. Lesser tubercle is the I have a muscle which lies in the anterior region, which is subscapularis muscle within the scapula. Then we learned regarding the medial and lateral aspect. Medial we learned regarding the latissimus dorsi once again. From the I said the upper part has a narrow region and the lower part is a broad region, which occupy majority of the posterior region. Remember, it is arises from the posterior and moves in the further region in the anterior region. So this is very important muscles. And the lateral we learned regarding the deltoid muscle. So this is a very easy and easy mark to score if you have been asked to write the muscles of the upper limb. So you can write any of the muscles. For they might ask you for 5 marks or 3 marks, what and all to write. You can write regarding the origin of the muscles, you can write regarding the insertion of the muscle, you can write regarding the function. The muscle which attach the anterior have a similar function. What is the function? First is regarding is the implementation of the arm and adduction of the arm. whereas the external have external rotation of the arm and the abduction of the arm. Sorry for the background noise. So I conclude my topic with this all the chapter. If you have any kind of doubt, so please free to bring to my notice. I'll surely resolve all your problems. Whatever improvement you want, you can please tell in the comment, or we have Instagram pages where we can reply to every other individual. Stay connected with us so that you can get more topics regarding the bones. There are many such bones in the upper limb and the lower limb. I know it's not an easy task to cover each other, but I can make a sure notice that I can cover the important points which will be very easy to for you all to cover in your exams, so that whatever the invigilator is expecting, you can write at least that much, and the diagram you can refer from my slides. I hope you enjoyed this video. Get you in the next video. Thank you.